Hello, today Rocio, CALDERON and BRITHNEY FERMIN will be showing you how to do a complete morning care for our client. This video will include hair care, oral care, bed bath, foot care, and perineal care. Now, by performing morning care, the nurse primarily promotes hygiene, which are practices conducive to maintaining health and preventing disease through cleanliness. By performing morning care, the nurse also removes any unwanted substances in any particular areas, prevents and removes any unpleasant odors, stimulates blood circulation in the particular areas, and by doing so, the nurse increases the client's comfort and sense of well-being. It is very important that the nurse conducts a thorough assessment of the client before performing any morning care activities. By doing so, the nurse will be able to identify key things such as the client's ability to assist in the procedure. For the sake of being thorough, we will include a slide before each activity listing the things that need to be assessed along with the list of equipment and materials that are needed for each procedure. Bear in mind that the preparation and collection of materials and equipment must be done prior to commencing the morning care activities and not while doing the morning care activities. It is also important to note that although assessment of the client is done beforehand, assessment is also simultaneously occurring while doing the morning care activities. The first activity will be hair care, and in the assessment phase, the nurse will determine if the client has any history of hypothyroidism, chemotherapy, or any conditions or therapies that might affect the head area. She will also determine the type of hair that the client has, as well as the condition of the hair. She will also determine if there is any specific procedures that might make manipulating the hair easier, as well as if the client has any specific products that he or she might like to use. The nurse will also determine if the client will be able to assist in the procedure. Prior to performing any of the activities, the nurse must introduce herself to the client and verify the client's name and date of birth. She must explain what she will be doing and why it is necessary. She must also get full consent from the client in order to perform any of the preceding activities. She must encourage the client to participate as much as she or she can. The nurse must then perform proper hygiene and provide for the client's privacy. In performing morning care, maintaining client privacy is a very important part. The nurse must assist the client to a comfortable position. She must then obtain the desired product and start applying it from the root of the hair, working her way down. Since the client's hair is short, she must start working from one side of the client's head and move around to the other side, removing knots and tangles from the root of the hair and working her way down. By doing so, this will ensure that client's discomfort is minimized. The nurse will continue to systematically groom the client's hair until it's free of tangles and knots. She will then proceed to styling the client's hair as requested by the client. She will then proceed to adding any additional product as requested or as required. She will assist the client to a comfortable position and prepare the client for the following activity. The following activity will be performing oral care for a conscious patient, followed by performing oral care for an unconscious patient. In the assessment phase, the nurse must perform a thorough inspection of the client's mouth regardless if the patient is conscious or unconscious. If the patient is conscious, the nurse must determine if the client is able to assist in the activity. The nurse will assist the client to a comfortable position, then the nurse will place a towel under the client's chin. The nurse must ensure that she wears gloves. Using a soft, bristled, moistened toothbrush, the nurse will apply the client's choice of dentifrice to the toothbrush. With a gentle motion, the nurse will move the toothbrush gently in an up and down movement, repeating until all outer and inner surfaces of the teeth and sucula of the gum are clean. The nurse will also clean the biting surfaces by moving the toothbrush gently back and forth. She will also ensure to brush the tongue gently, avoiding initiating the gag reflex. The nurse will continue repeating the movements until the teeth, gum, and tongue are thoroughly clean. She will then have the client vigorously rinse his mouth with water or mouthwash. She will then continue by flossing the client's teeth. She will move the floss in an up and down motion between the teeth, being careful when the floss reaches the gum line. She will gently move the floss away from the gum with an up and down movement. She will also floss the bottom teeth by performing the same motion. She will once again have the client rinse his mouth with water or mouthwash. She will then assist the client to dry off, and then she will remove both the curved basin and the towel, preparing the client for the next activity. In this variation, we will see the nurse performing oral care for an unconscious client. The nurse must assist the patient to a side-lying position with the head of the bed lowered. She must then place a towel under the client's chin. She must also place a curved basin against the client's chin and lower cheek to receive the fluid from the mouth. In this variation, we see that the nurse is using a tongue depressor to pry the mouth open. She can either clean the teeth as shown in the variation for a conscious client, or she can clean the teeth by using swabs. Using separate applicators, the nurse will clean all areas of the teeth. She will also ensure that she cleans the mucous membranes of the mouth. She will clean the sides of the cheek, the roof of the mouth, the base of the mouth, and the tongue, once again using a separate applicator for each area. She will then rinse the client's mouth by drawing approximately 10 ml of alcohol-free mouthwash into a syringe and carefully injecting it into each side of the client's mouth. She will carefully watch to make sure that all the rinsing solution has run out of the client's mouth and into the basin. If not, she will use a suction to suction the fluid from the mouth. She will repeat as much time as needed. She will then assist the client by drying off the client and carefully repositioning the client back on the bed, preparing the client for the next activity. The next activities will be bed bath and foot care. The nurse must do a thorough assessment of the client for both the bed bath and the foot care. This will help the nurse determine the client's self-care abilities as well as any additional information as listed on the slides. After the nurses have assessed the client, the nurse will then prepare both the client and the bed. The bed will be placed at a proper working height for both nurses. Then a top sheet will be placed over the client so as to be able to remove the client's gown without exposing the client too much. This will prepare the client for the bed bath. After the client has been prepared, the nurses will place a towel under the client's head to wash the client's head. The nurses will start by washing the client's eye with only water. They will use a separate corner of the washcloth for each eye. As a nurse washes the client's face, another nurse immediately dries the client's face. They will ensure to wash, rinse, and dry the client's face, ears, and neck, and apply any appropriate ointment as requested by the client. They will then wash the client's arm. They will place a towel lengthwise under the arm of the client. They will wash, rinse, and dry the arm by elevating the client's arm, ensuring to support the arm. They will use long, firm strokes from the wrist to the shoulder, including the axillary area. As mentioned before, as a nurse washes the client's arm, another nurse immediately dries it off. They will apply deodorant or powder as requested or as required. The nurses will then assist the client to wash their hands in a basin, being careful and considerate to wash between the digits. The nurses will then assist the client in drying the hands, once again being careful and ensuring to dry between the digits. The nurses will then apply any lotion as requested by the client or as required for the client. The nurses will then move on to cleansing the client's chest and abdomen. The nurses will first wash the client's chest and then they will move downwards towards the client's breast. Special attention should be paid to the skin under the client's breast. The nurse will ensure that they properly wipe the client's abdomen as well as the side of the client's abdomen. Once again, as a nurse washes the client, another nurse ensures that she properly dries the client, especially under the client's breast. Nurses will proceed by washing the client's leg. They will place a towel under the client's leg so as to protect the bed mattress. They will start by using long firm stroke from the distal to the proximal area, washing the client's leg. As the nurse washes the client's leg, another nurse dries the client's leg. They will repeat the process on the other leg. At this point, the nurse can decide to change the water or to keep the water. The next step will be to provide foot care. The nurse will proceed by providing foot care, and in order to do that, the nurse must ensure that she properly positions the client's feet and leg so as to provide optimal comfort during the foot care procedure. The nurse will then proceed by placing the client's feet in a basin of soap and water. The nurse will soak the client's feet if required and if the client's health allows for about 5 to 20 minutes. The nurse will then proceed to washing the client's feet, the surface of the client's feet, in between the client's toes, and scrubbing the plantar surface of the client's feet. After she is finished washing, she will ensure that she thoroughly rinses the client's feet in water. Then she will remove the basin and she will ensure that she thoroughly dries the client's feet, ensuring that she dries the surface of the feet in between the client's toes and the plantar surface of the client's feet. The The nurse will proceed by performing the same procedure on the next foot. She will then apply lotion or ointment as requested by the client or as required for the client. Once the nurse is done, the nurse will then obtain fresh water to wash the client's back. The nurses will assist the client to a sideline position and then a bath towel will be placed on the bed. The nurse will then start by thoroughly washing the client's back. If the client has skin folds, special attention would be paid to the skin folds. The nurse will then continue by properly drying the client's back, ensuring that there is no moisture. The next procedure is to conduct perineal care for both a female and a male client. The nurse will conduct thorough assessment of the client's perineal area, then gather her supplies and materials before starting. The nurse will start by positioning the male client in a supine position with his knees slightly flexed and his hips slightly rotated. She will then prepare the genital area for washing. The nurse will proceed by washing the client's inner thighs on both sides. As the nurse is washing the inner thighs, she is conducting assessment and inspection of the client's inner thighs. She will then proceed to drying the client's inner thighs, ensuring that there is no moisture. The nurse will then wash the client's penis by using firm strokes. If the client is uncircumcised, the nurse will retract the foreskin of the penis and wash the tip of the penis. The nurse will continue these motions, ensuring that the entire shaft of the penis is properly cleansed. She will then proceed to dry the client's penis, ensuring that there is no moisture. The nurse will then move on to washing the client's scrotum using the same firm strokes. Particular attention will be paid to any skin folds. The nurse will continue repeating the motions, ensuring that the entire scrotum is cleansed. As the nurse is conducting this, she is simultaneously conducting assessment and inspecting the area for any unusual things. The nurse will then move on to drying the client's scrotum, ensuring that there is no moisture, once again paying particular attention to any skin folds around the scrotal area. Before washing the client's buttocks, we will show a variation of the female perineal care. The nurse will start by positioning the client in a lithotomy position. This will allow the client to have better access to the female's perineal area. She will then start by washing the client's thigh using firm large strokes. This will promote venous return. As she is washing the client's thigh, she will simultaneously conduct assessment and inspect the client's thighs for any unusual things. The nurse will then continue by wiping the client's labia majora. She will rinse the cloth after every wipe. She will then proceed to washing the labia minora and ensuring to wipe between the crease of the labia majora and the labia minora. From pubis to rectum, the nurse will continue to wipe the client's perineal area. She will then place a bedpan to rinse out the client's perineal area. She will properly rinse the client's perineal area, removing any excess soap. She will then properly dry the client's perineal area, ensuring to dry in between the creases. The nurse will then proceed to wiping the client's buttock, ensuring to wipe one cheek, rinsing the cloth, wiping the other cheek, then rinsing the cloth, and once again wiping in between the two cheeks and rinsing the cloth again. It is very important to rinse the cloth after every wipe. The nurse will then ensure that she properly dries the client's buttocks, ensuring that she dries carefully under any crease. The nurses will then remove the Macintosh, preparing the client for the next step. If needed, the nurse will place a pampers on the client. The client's health status will determine whether or not the client needs to wear a pampers. The nurse will ensure that the pampers is properly positioned and that it's secured properly. After that, the nurse will put on a fresh new gown on the client. They will remove any linen that has been soiled or that has been wet. If a linen change is required, the nurses will then perform that. After they have done that, the nurse will tuck back the client in, ensuring that the client is in a comfortable position. And that would be the end of a complete morning care. The nurse will then prepare herself for documenting. She will document any unusual findings. She will document the client's ability to assist and the client's tolerance level to all the activities. She will also document if there is any impaired skin integrity or any unusual findings that might be alarming. The nurse will ensure to document all those things. And that's the end of our presentation. All information can be found in the Cozy on Herbs Fundamentals of Nursing 10th edition. Thank you for watching. Bye.